This is an amazing day today where RC Bulindo is hosting a pre-cancer run walk. Others will call it a cancer walk. But this is a tradition at our Rotary Club of Bulindo where we have a walk prior to the run at Kololo. So ours here is to rally our community, to rally our friends, to rally the neighboring clubs to come and join us, and we create awareness. One, that cancer is real and cancer can be treated at the early stages, but also that we can rally the cause that people can test early. So that is partly what we intend to do today as we are going out to walk. And we already have here gathered with us about over 50 people who are coming to join us, and hopefully we shall get to 100. It's an 8-kilometer walk, and we hope that we shall be able to go back, to make it back and forth. So I'd like to welcome you, and I'd like to energize you that let us go for it, let us go for gold.
Rotary Club of Bulindo, this is the pre-cancer walk. Come and join us on 4th.
Come and join us. Why we have a pre-cancer run walk is create one awareness in our community that cancer is real and cancer can be intervened. We are trying to also to rally people towards the cancer run that is happening on the 4th of September at Kololo. So this is more of us just to reawaken our community to the cause which is happening on the 4th of September.
We are proud of this activity, as we are going to the fund that we are raising, supposed to help in the well-being of our community and the world at large. So we commend Rotary for that, and I'm proud of being a Rotarian.
We are doing this in preparation of the Cancer Run, scheduled for Sunday, this coming week.
So it's been a lovely walk all the way from our home to around about and back. Thank you so much everyone for joining us. Cheers.
Hello, I'm called Rita from Tukutwe. It's a child club by Bulindo, and we are here to support our mother club for the run. Thank you.
Please go run for the Cancer Run on 4th. This is a pre-cancer run of the Rotary Club of Bulindo next Sunday at Kololo.
Yes, hello people. We're here for the Cancer Walk to announce the oncoming Cancer Run at Kololo on the 4th of September. Please join. We're here for a cause to contribute towards the bankers at Insambia Hospital, and this is the Rotary Club of Bulindo. We'd like to stand with you and we'd like to request you to come and join us on Sunday. Thank you.
My name is Migisha Krista Queen. I'm 12 years old and I'm in P7. I am tired, but it's worth it.
And with this, the cancer project is intending to raise about 1.2 billion shillings towards the purchase of or the construction of bunkers at St. Francis Hospital in Zambia. So we hope that by us raising this awareness and calling on our people, calling on our community to join the cause, you buy a kit at 25,000, and part of that money is going towards this project to acquire bunkers, so to get bunkers for the linear accelerators at St. Francis in Zambia. So this is how we can give back, and this is how we can get engaged in this project. So we are not looking at it from the other side. We only look at it as giving back to the cause.
Welcome to the Cancer Run. 11 years going. And what is amazing about this one is that we've had 40,000 runners registered. 13 cities outside Uganda. 11 cities within Uganda have run, not just here in Kololo. But what is amazing is that we managed to collect 1.3 billion Uganda shillings. I welcome you to the Cancer Run and welcome to the Rotary Moment Show. kilometer, there's a 10 kilometer and a 5 kilometer. And all these have been run by Rotarians and well-wishers of Rotary. And what is amazing about this is that cancer is real and it has affected a lot of people. What I wanted to tell you earlier is that you're going to hear our president, our Rotary International president, telling us that she had cancer 12 years ago. And today, 12 years later, she's here launching the Cancer Run and she's cancer-free. Like you're going to see, she says cancer can go, and a lot of us believe that you can be healed from cancer. But what can you do? Early detection, and then you go get checked. When you get checked, you can easily survive cancer. It is a treatable disease.
Thank you so much for everything that you did to get up early today, to come out here, put on this beautiful blue shirt. Looking out over the horizon right now of all of you is such a spectacular sight. 12 years ago, I discovered that I had breast cancer. It wasn't easy. It took a year to get better. But part of the reason I share that story with you is because I think it's important for us to know that early detection is something that needs to be done. We need to make sure that our families, that our loved ones, if something doesn't feel right, that we get tested, because this is a treatable disease many, many times. Not always, but many times. So be good to yourselves. Make sure your families understand what's going on. But understand, there's always hope. And 12 years later, I am proud to stand here and say no more cancer. Thank you so much for the incredible joy that you are bringing to this day. Thank you all for your leadership, and thank you for getting out and exercising, one of the best things we can do to keep ourselves healthy. And thank you to the organizing committee for your incredible drive and passion, and for making this one of the most beautiful things I think I've ever seen. Good morning to you all, and thank you so much for your incredible kindness, your leadership, and for raising powerful dollars for no more cancer. Thank you.
One of the most interesting things I've seen today is people sweating for cancer. As you can see, people are coming in, they're very tired. We have people who have run 20 kilometers, we have people who have run 10 kilometers, and they've come back sweating beads and beads of sweat. But what is amazing and what is humbling for us is that they are running for cancer. And it's an amazing experience that people are running for cancer. That choice for a run to solve the problem for cancer is one of the most beautiful ideas. And I want to thank the past district governor, Stephen Mwanje, for having started this initiative, because he has done wonderfully. I want to thank the PRO teams, Joanna, Rotarian Joanna, who has been head of PR, for having done an amazing job. 40,000 runners today have run here at Kololo. And we've had 11 cities across the world running for cancer. So while we are making sure people are running, there's also people enjoying themselves on the bikes and promoting cancer prevention. Welcome to the Rotary Moment Show.
Thank you very much. Good morning. The name is Angela Semkuto, President Uganda Bikers, and I'm also a Rotarian from the Rotary Club of Kampala Mienga Breeze. Ours today is to come here as a fraternity that relates well with Rotary Uganda. One of our core values is cancer prevention, and so we team up with Rotary Uganda to participate in the activities of Rotary, and which include the Cancer Run. So for us, it's coming here, vibing people, if that's the correct word. We are vibing people, we're getting them all psyched up so that we all take part in this Cancer Run.
Wonderful. I see everybody that is happy and you're taking joy words. Can I join in?
Yes, you can join in.
Do you want me to join in? I'm sure I'll join in later, but thank you very much for allowing us. Let me let you go on.
Come on, guys. See. Ready for energy. See. Come on. Let's go. Let's go. See. Still warming up, guys. Let's go. Give me the vibe. 1, 2, 3, let's go. Everyone, let's go. Hey.
Life is what you make it. Zena sala wakukuwa hiti. Wamabomba sakata beat. Baya ya bajibara ku street. Sexy ladies shake it. All them fine girls they like it. Cause in my city, parties in my city. Elanga soka kulisha ba life is city. New life is city.
It has been a successful cancer run. 2 years virtual runs, and today we registered 40,000 people for the cancer run. 11 cities outside Uganda, and so many embassies have run. And what is amazing is that the leader of this cancer run is still seated and waiting for the last man to go.
I'm glad to be here this morning, and especially after this successful run that we've had today. I pride myself in the organizing committee that I put together. Truth be told, we are not many. We had an organizing committee of about 15 members, but the 15 members had other subcommittees. And the way we mobilized the masses, the people, the clubs, the communities, the sponsors was so massive. People were responsive, and they were very ready to come and run with us. I think it's been a whole 2 years and plus of virtual runs, and people were ready to come and run together. It was our theme this year was together again. So people were ready to come and we be together. We mobilized massively. We went into clubs mobilized other people, and that's why you've seen the numbers grow big. We did not grow only in numbers, but also in the money. You said we've raised about 1.3 billion net. That's net excluding the expenses that we incurred during the run. So it actually shows you how much people and corporate companies were ready to come back and also be part of this. In the last 2 years, I believe that all of us, in a way, we've been touched. We've lost our loved ones. People who had cancer died. Some died of COVID, others died of cancer. And what we are running for a good cause. Yes, going to Zambia and putting up that cancer center. We are running for a cause. It's a good cause. And many people were willing to come and be part of this. You saw when the RI president was addressing us, she's a cancer survivor. Yes. So it actually tells you how she's passionate. It is something that is on her heart, that this is something I should participate in, and I come and be part of it. So, and we want to thank our sponsors, we want to thank the participants. Oh my God, this was massive. It was massive. We have enjoyed ourselves, and it was great. And thank you, Carol, also for coming through and also being able to capture this moment. It's a great moment in our lives and in our Rotary life.
As Ugandans, we believe that after polio, our focus in Uganda is to eradicate cancer.
The person I'm introducing is the past District Governor Stephen Mwanje, and also the Rotarian who started the Rotary Cancer Run. Thank you very much, and thank you for allowing us to interview you. I'm not even going to ask you about the organization. I'm going to ask you how you feel about this organization. This is the first one where we have the RIP, the Rotary International President, as a chief runner. How do you feel? How has today been? Because you've had the biggest number ever, 40,000. How do you feel about your baby?
I'm excited. First of all, it's a dream come true. 11 years ago, I possibly dreamt of something as big as this. But I didn't think it would happen, maybe in my lifetime. It's come too fast. So I'm excited. Yeah. But I'm not contented yet. Because it's not about numbers. It's not even about monies. It's about the impact. As long as cancer remains top killer of people in this country, then I haven't done enough work yet. That's why I'm saying, yes, I'm excited about the cancer run, but I'm not yet contented because we still have a lot of work to do. We must address the death due to cancer. We must stop people dying unnecessarily because of cancer, and you can do something about it. So what do we need to do? We must talk about cancer all the time. We must put cancer on our dining tables, in our sitting rooms. Talk about it with your children. Tell them to go for early screening. Share this with your parents. Share this with your colleagues. When that is done, then you are going to reduce the numbers, because when cancer is detected early, chance of survival increase. But even for those that eventually get sick, that we are able to capture at whatever stage, we must have a facility to look after them. Nobody deserves to die of cancer, not at all.
You know, this is very inspiring. Now, earlier on, I asked the head of PR about the access to the facilities of the cancer center in Zambia. And I asked her if somebody walked in today, because we saw a lot of disabled people, we saw people limping, you know, somebody has come with a cane, but they're wearing the cancer t-shirt. And I asked her, somebody from Karamoja will wear this t-shirt and say, you know, this might be my ticket into the center. What does a person have to do to come and access help or medication at the center?
Nothing.
I want you to look into my camera and tell the viewers.
Nothing. Anybody can access the cancer center right now. The challenge though is, as we speak now, services are not yet free, because the medicines are very expensive, so are the costs of maintaining the good professionals we have in that facility. So one of our long-term dreams is that after we finish construction of the cancer center, the bankers, and bring in the new accelerators, we are going to set up a cancer foundation, a Uganda Rotary Cancer Foundation, and the funds in that foundation will be used to subsidize on bills for patients who can't afford. Our long-term target is that in Zambia adopts a no turn away patient policy. So all you have to do is to get transport to reach in Zambia. And thereafter, whether you can afford the treatment or not, you should be treated. That's our dream. But for now, people still have to pay, because we don't have the medicines for free, neither do we have the qualified staff. We have got to raise money to maintain those staff there. Yes.
Thank you very much, RI President and the entire leadership of Rotary. We at Centenary Bank, we are proud and happy to be part of this. Of course, we deal in money, as you know, but it's not all about money. It is about what that money does to the communities. And we believe in shared value. In Uganda, there is a saying that if everybody is eating, the food is very enjoyable. And therefore, for us to have everybody share in what we do, we are very glad and always very happy. That's why we are happy to be part of this. And we want to thank Rotary for giving us that opportunity to be part of this, to be in this partnership. That's why we've been able to be sponsoring this for the last 11 years. We've contributed around $600,000 to these initiatives. We've led over 200 cancer parades. We've bought over 11,000 cancer kits, test kits, and many other things. And we pledge to continue doing that. And we thank you. We thank all of you, participants, and of course,
the platinum sponsor for Rotary events and Rotary is Centenary Bank. We'll always be Centenary Bank. But like I want to quote him previously, he said, with zero grace, and this is a monogamous marriage, we must and we should ensure that this relationship remains that way, because he's done a lot. I just had him a while back saying they've contributed over $600,000 into Rotary. And right now, I want to thank him for putting out his heart and his company and the bank for sponsoring Rotary in the different causes. Thank you very much, Rotarian Fabian Kasi, Major Donor, and all those other nice accolades you have. Yes. One of the things I want to thank you for is for the big heart you have for Rotary. Tell us about the Cancer Run. Why is the bank interested in the Cancer Run? And then why is the bank interested in Rotary? I always want to ask you that question so that the next person who didn't watch the previous show understands your interest in Rotary.
Well, as I mentioned earlier on, at Senare Bank we deal in money. Yes. We are supposed to ensure that people become wealthy, but at the same time it is not the money that matters most. What matters is what that money does. And we want that money to be transforming lives of people. We want social transformation, economic transformation, and so on. But as they say usually, health is wealth. If you are not healthy, all these other things we do will come to naught. That's why Senare Bank chose an area in health where it can make a contribution to ensure that our people, the community that we deal with, stay healthy. Having identified cancer as one of the key killer disease, and also knowing that Rotary is also engaged in that area, we found a very perfect partnership. And that's why we've been journeying together all the time for the last 11 years. We've been sponsoring these cancer runs as one of the activities that we use to raise awareness, first of all, but also to raise funds to be able to do the things that we want to do in order to fight cancer. So that's where it all starts, and probably that's where it ends, because we will always be in partnership, we will always be supportive, because this is an area where we think we need to continue supporting to ensure that, first of all, people are sensitized, they are aware of how to prevent, minimize cancer, and those who are tested to be sick, how to be treated. And that's how we came up with the idea of the cancer ward at Nsambya Hospital. We are now working at the bunkers where they will be, storing the materials that will be used for chemotherapy and so on. All those are activities that we believe are going in the right direction to ensure that we win in this struggle.
And only those that are alive can put money in the bank, right?
Absolutely, absolutely. I mean, that's what it is, unfortunately. But naturally, that's what it is. And we want everybody to be alive so that they can continue to work with us. As I was saying, we believe in the concept of shared value. Whatever we do as a bank, we want everybody to share in it. As the Baganda say, onalya n'olyalya yemmere egenda. When everybody is eating, it is an enjoyable meal, and that's what we want to have. As the bank grows, we want the people to also be growing, to also be transforming, prospering, and so on. And that's how we will be able to sustainably do what we are supposed to do.
And indeed, following what Rotary says, you want everybody to prosper, you want everybody to be well, yes. And you're serving above self as well.
That's right.
Thank you very much, Fabian. Thank you, Rotarian Fabian. Thank you for all the contribution you give to Rotary. I don't know if my appreciation means anything.
It does.
And I know
it does a lot. It does a lot.
I know everybody else appreciates you, but you've done a great job. Thank you very much.
Thank you very much. All the best. You are doing a good job.
Thank you. Past President Joanna June Nanyonjo has been the head of PR for the Cancer Run. She's also managed to bring every media house that you're going to watch on TV, in the news, and in the newspapers together. Us as the Rotary moment, we are privileged to belong to Rotary. And as a mandate, she invited us to come and cover this entire event. You're going to see a lot of lovely things. But what I want her to get into is how one can organize a run as successfully as this, because we've had 40,000 runners, and a lot of other cities have gone ahead to run for cancer, and in different countries. Past President Joanna, how have you managed this? And congratulations on 1.3 billion shillings. That's a lot of money. That's a banker coming, $400,000. Now I want to ask you, how did you get this together? What is the next person going to become the PR director? What are they going to do? How can they achieve this?
Okay. Thank you, Carol. The Rotary Cancer Run has a big organization team or organizing team, and we start the organization as early as soon as we finish a run, we start. As soon as we finish the run, we start organizing the next. It's a big team of over 100 people who put the Cancer Run together. This year, I've been privileged to be the chair of the PR committee, and as a PR chair, it's just a lot to do, but to make sure that the Cancer Run is known by everyone and everyone is on board. So we bring on board all media houses. Media houses are our partners, and they come to cover this run. We have all the media houses in Uganda you can ever think about. Online, newspapers, radios, TVs. We have had live coverage. We have so many media partners, and some of our partners come in and give us media sponsorship. We have very many sponsors. I cannot actually mention even half of them, but you all know Centenary Bank is one of our biggest sponsors. The Parliament of Uganda, Mad Advertisement, and so many others that have come in to give us all the publicity and all the funds that we have received. As already said, this year we have managed to collect 1.3 billion shillings so far. We are sure more is still flowing into the accounts. So we are very excited that after 2 years of virtual runs, here we are with a very successful physical run, and we are very excited. We want to thank all our partners. We want to thank the public. We want to thank the Rotarians. We want to thank Rotary clubs. We want to thank each one of you who has bought a kit or who has sent us some money. Ladies and gentlemen, this year we are running to build a bunker. 2 bunkers. Bunkers are specialized places where we keep the LINAC machines that we are going to purchase. So this year we have been running to contribute money to that cause. We started the construction in May, and at the moment construction is underway, but we need a lot of money to have these 2 bunkers constructed. Otherwise, before that, we have built a 36-bed cancer ward at Zambia Hospital. It's already operational and fully equipped. And we also contributed to the building of the Mengo Blood Bank because we need blood for the treatment of cancer. And now the phase we're at is to build bunkers that will house these machines. We have intentions of buying 2 ultra-modern cancer treatment and screening machines that will be housed in the facilities we are fundraising for today. So we still need money. Thank you very much for all your support.
Thank you very much, Past President Joanna. I know that a lot of work has to go into cancer. And like the RI President has said, it's treatable. And this is our only avenue of treating cancer. So if you support the Rotary Cancer Run and the Rotary Cancer Initiative, this is how you help treat cancer. So do donate. If you're out there, any penny can do. Thank you very much for allowing to take out. We started at 6 this morning and we ran. The chief runner was the Rotary International President, Dr. Jennifer Jones. She ran and she flagged everybody off for the run. There's nothing that gives me pleasure than saying 40,000 runners, people that registered, 1.3 billion raised for a bunker, $400,000. Thank you, Ugandans. And all the different cities that have run, about 11 cities across the world, so many embassies. Thank you very much. To the sponsors of the Cancer Run, thank you. I can't mention all of you. Centenary Bank, New Vision, CIPLA, and so many others. Thank you very much for making sure that this is successful. I will tell you that without your support, Rotary cannot achieve the different things that you have heard that our interviewees are talking about. But as you can see, it is now empty and people have gone back to do their work. Everybody is a candidate for cancer. You can get cancer, I can get cancer, and any other person. Let us support this cause. It is a beautiful, beautiful sunny day. We came this morning at chilly hours of the morning and people ran 40, 20, 10 and 5 kilometers. We had so many walkers, but it has been an interesting day so far. We have eaten and taken our fruits and now it's about time to go home. The Rotary Moment is a Rotary program that has a YouTube channel on YouTube, the Rotary Moment Show. We also have a show on UBC here every Tuesday and we show events and activities of Rotary. We want to thank you for the wonderful, wonderful views and different feedback that you give us about Rotary. Thank you. We also invite you to come and join Rotary, both young and old, within Rotary and Rotaract. It is amazing the things you can do in Rotary. Like you can see, we have just raised 1.3 billion shillings on a run out of all the Rotarians that we have here in Uganda, and so many other well-wishers, those that have been affected by cancer. Thank you very much. I remain Rotarian Karo Chazekakoza from the Rotary Club of Chiwatude. Catch us again on YouTube on the Rotary Moment Show. Thank you.